Michael Gesser, and originally a New Yorker. I live in Alaska and Miami. And I had, when I was a young person in New York, I was playing freeze tag on Long Island when I was 11, and my knee locked up. Turned out I had a cyst on my lateral meniscus, and so the surgeries of the time were obviously a bit more basic, and they took the meniscus with the cyst, and so I've been bone on bone since I was 11 years old. I somehow managed to do activities somewhere along the way. I climbed mountains, I traveled around the world, I did like skiings, I did like bikings, and somehow learned how to manage my pain. Well, I mean, you know, with Dr. Buechel, he's just calm and he has the, you know, demeanor of a human being that gets stuff done. At the end of the day, you know, you get in a room with him, you go, yeah, he's a guy to get stuff done. I don't want to throw anybody under the bus, but there were a lot of people that only wanted to do a full knee replacement, and we had actually exhausted the opportunity set. And we couldn't find Dr. Buechel because he was traveling so much, and we had gotten so many people that rejected the idea of the partial that I had actually scheduled myself for a full knee replacement, which was going to be done in Vail, Colorado. And I literally, a week before, I just really felt I hadn't exhausted all the opportunity sets until I found Dr. Buechel. We did it at Athletics Hospital, and the last thing I remember is a room with a lot of people with spacesuits on, and I saw my friendly robot, and then I really walked out of that. I think 8 hours later, I woke up and had some cookies and tea, and my friend gasped because I was listening because I had ground this down so much because I had used it so aggressively that I was literally at an 8-degree list. And I was like bone on bone for like decades. And so, I mean, I literally became square. So I gained like 1.5 inches of height fundamentally, and I walked square as opposed to, you know, compensating and you know, and listing. A couple of Percocets for sleeping a couple of nights. In the end of the day, that's it fundamentally. A little bit of swelling, I did icing and stuff, and I did physical therapy, and I actually had more pain before the surgery. Yes, he's an extraordinary man and an extraordinary surgeon, and the technology is phenomenal. It's literally absolutely an exciting time to be alive. Dr. Buechel is amazing, and robots are amazing, and Moore's Law is alive and well. Good computers get smarter all the time, and yeah, it's awesome.